So to be honest, it's more like an accident. When I was doing MA Anthropology, I never thought I'll get into public health field. But towards the end of my 2-year program, as a class, we had to go and study a particular community. And we studied a community in Gudalur in Tamil Nadu. We stayed there for 30 days. And each of us has to pick up a topic and one element of the culture we study. I somehow picked up a topic called health and sanitation among this particular community. That is the kind of a seed with which it started, my interest in health and sanitation. And as I finished this 2-year program, that time somehow I had an interest in joining JNU. My brother was there in JNU, so I applied to 3-4 centers there, including social medicine, community health, because I had a small topic I had done on health and sanitation. And I got into this center and I joined. I mean, that is a start. This center, of course, influenced me quite a bit. JNU especially, with a strong political climate, a political socialization there, and the center with a strong political economy background sort of influenced me heavily. And we also had a kind of a study forum in JNU, which also influenced heavily on understanding social issues, importance of social issues. I don't know whether to call it as an ideology or a critical look into social reality, but that has heavily shaped me, and I think still I carry those influence on me. And I did a sort of an ethnographic study in Tamil Nadu for my PhD research from JNU, where again I looked at family formation issues in one of the villages, the agrarian village. So in terms of health, women's work, methodology, a lot of things got shaped in my days of JNU and the work I did in JNU, and beyond the academic environment, also the climate of JNU, political climate of JNU, political socialization which we got in JNU has shaped me into this kind of public health interest, as well as the kind of interest I have in public health, the way I look at problems in public health. Yeah, as a student of social science, as well as a student of JNU, I see a very strong role of social aspects like social structure, social stratification, the state, role of state, etc., having very strong role on health. So health is certainly a political subject. Health is basically politics, and medicine and health is very much a part of society, and the distinction we make between a health problem and a social problem is an artificial distinction. So if you consider, say, a disease like malaria or tuberculosis, or a behavioral intervention, or a technology or surgery like a hysterectomy, they may be seemingly straightforward, scientific, unconnected to society, etc. But when they get transplanted into society, onto society, it incorporates the characteristic features of a society. It incorporates, it absorbs, it assimilates, and therefore it radiates those features of society. It could be in the form of the disparities in society across gender, across caste, across people with different economic status. So this influence of society or the social aspects getting assimilated into this medical problems or medical interventions or medical technology happens at multiple levels. It can be at the level of individual, at a small society called maybe a village. It also happens at the macro level of politics, how decisions happen at the state level or national level. And these have far-reaching implications on health. So a medical model or a public health understanding is not that they don't acknowledge it, but they don't treat it as seriously or as rigorously as they treat evidence within the level of behavior. So that is a fundamental problem or difference between a medical or public health model and a social science or social determinant approach. SDH approach came in a context, and to my mind it's a product of efforts from a body largely directed by public health experts, and therefore it retained a kind of a lineation, a kind of a inclination towards public health, and somehow it believed in the need for demonstrating and explaining a pathway which is based on a biological basis or psychological or environmental basis that connects between the social factors or social basis and health problems. This is a fundamental aspect of the approach. For me, as a social science person, leads to a lot of problems. So this believes that any association or link or influence of social factors on health has to be established through a pathway believed in a medical understanding. And therefore you tend to choose knowledge to handle this problem only from certain kinds of disciplines. And it's not that other disciplines like anthropology, social sciences, economics, demography have not been addressing about health problems, or not that they're not been talking about the social basis of health. So what happens by inclining towards a particular approach and a preoccupation with a pathway, a causative model, you tend to ignore other forms of knowledge, and other disciplines have also enormously changed, progressed. They have a nuanced understanding of social problems, social reality, etc. So we fail in adequately gaining from the disciplines who have also grown as much as medicine has grown. So if we take the understanding of health in two parts, one is a natural science or a hardcore or a common sense understanding of science of a specific problem, say malaria, how it causes, how it gets spread, how it can be addressed, how can be the malaria as a disease can be treated. So we have fantastic knowledge as far as this is concerned. But it comes to translating this problem into a social solution embedded in society. There you need expertise of knowledge from social science people. But that kind of a rigorous incorporation of those knowledge is not seen in this SDH. And that kind of interdisciplinary efforts is, I feel, is wanted. So when the same set of people, or I don't know what the process which goes behind development of such kinds of reports, the handling of the social aspect of delivery of a problem, solving a problem or delivering a solution is more often treated as a more amateurish manner. Like if you have designed a program and you want to implement at a national level, state level, it's a issue of politics, issue of economy, large macroeconomic level. So that level you need certainly people from certain specific disciplines who have done expert knowledge, done expert research. But certainly the commission and its report was important in the sense that it gave global level legitimacy to the whole idea of social justice and equity, not only in general but even within the medical and public health fraternity. I mean, you have world famous physicians talking about the need for social determinants with the backup of World Health Organization. I think that's a very strong message going across, and that has to be appreciated. A lot of work has been done on keeping in mind social determinants. They've been largely treated as determinants, factors, and we have tried to address these problems at levels of behavior change, at the level of micro level solutions. And these micro level solutions are scaled up, but the solution remains as the micro level solutions. But the larger problems of development, the kind of development which is required to reach a certain level where certain basic requirements of life, such as water, sanitation, better clean environment, better cities, transport, electricity, which many European countries had achieved many decades earlier, which we have failed to achieve. And to me, these are all bigger macro determinants of health. Unless we address these macro pictures, we'll be only addressing piecemeal problems, piecemeal solutions. We'll not be addressing the macro pictures, and we'll be always talking about short-term solutions, and we keep shying away from long-term solutions. I think that's a problem. So it's not about that we don't understand the importance of social determinants, but what kind of determinants we take up and what kind of solutions we choose to adopt for addressing this social determinants. That's a problem. So as young scholars, what are maybe the disciplines they go or sub-disciplines they choose to study in public health? In every sub-discipline, need for a perspective is important. A mere understanding of facts, solutions, skills, without a perspective, it's not learning or not education. It's only capacity building. It's only training. So what education offers is a perspective. And social science, the interface of society and medicine, interface of society and technology, interface of society and health system, that understanding is a perspective. So that perspective is certainly important to ground whatever may be the learning, skills, etc. They may pick up in any sub-disciplines or subjects within public health. So that perspective is certainly important. And this perspective, especially for a public health person, this perspective is certainly important of a perspective with a certain kind of value of understanding a state, for example, as an agency which provides welfare. Public health as a discipline which provides welfare. A perspective which says social injustice or inequity is not all right. Okay, I think that underlying perspective is important for any public health professional, and that's what the social science approach provides. And apart from this, even as a sub-discipline, social science as a track within public health itself is a germane ground for studying separately within public health. Yeah.